The way you would prepare a blood sample to go out to diagnostics would be to place the blood into your blood collection tube. This particular one will get spun down in the centrifuge, and then make sure that the pet's information is written down with the first and last name, account number, date of birth, date and time collected, and then the initials of the person who took it. And then with this and whatever other samples are going to go out, would get placed into the Antec bag along with the paperwork. This one was printed out specifically for this pet, and it's asking for the comprehensive senior profile panel, which would include urine and a fecal. So that paper gets folded and also make sure that the blood collection tube's information matches the information that's printed out on the form. And then once that's completed, it'll get placed into the refrigerator with the rest of the samples going out to await Antec, who will pick up at the end of the day. And then we'll get our results the next day, hopefully. So that is a sample that is ready to go out. There are also handwritten ones, which we don't use very frequently unless there's something wrong with our connection with the computer and the internet when we send it in. And what you would do would just be fill in the client information and the patient information, which doctor it is, and what test it is you want to be ran. Say, for instance, the feline comprehensive, make sure that's checked off, and make sure all the corresponding tests are gathered for that. And then if you were to send out a biopsy sample, get the formalin container, which is already pre-filled with formalin, that way. And the same as the blood collection would be to put all the patient's information on to the bottle. You can also print this one out, or there's also the handwritten one. And the handwritten one, you would say where the mass possibly was taken off on the pet's body, pet's information, client information, and what it is that we are running for, and whether or not it's stat. And the formalin container, make sure that you're not touching the actual formalin with your bare hands. You'd be wearing gloves to prep the sample. And then this would be packaged very tightly, and a seal put around the top just to make sure it doesn't leak. And this would be put into a small container. And in the small container, it would also have some sort of bubble wrap or paper around it to keep it from jarring and leaking. Alright, I'm going to clean up the microscope before I decide to start using it, in case it's dusty or dirty. The microscope should always be covered with its drape just to keep dust out. So the first thing I'll do is take this guy off. And just set it aside. When you're cleaning, it's always a good idea to unplug the microscope just so you don't get any electric shock in case you're using anything with moisture on it. The next thing I'm going to do is, I know that somebody was using oil on the oil immersion lens. So what I'm going to do is just take a lens paper and just a teeny bit of alcohol, which is not always recommended. It can break down the lens, but if you have hardened oil on it, it's one of the only things that could get it off. The higher percent of alcohol, the better. Try not to get it on any plastic pieces. So I'm just going to fold it small so it's not touching anything else. And I'm just going to gently rub the lens. And then I'm going to take another piece that's dry and put just a tiny bit of distilled water on it. And what I'm going to do is take that piece and just wipe it over the alcohol so that it's not dissolving anything, and just wipe off any excess. And last but not least, a dry piece to very, very gently dry the slide, or the lens. Alright. Next, I am going to just look at the lenses. The lenses look like there's some dust on them. And you can do the same, just distilled water to dust them off. There's also brushes that you can use to dust them off, or something to blow them off. All honesty, it's so dry here that there's always dust. So to blow on it in any way, shape, or form is going to cause more dust to fly up. So I'll use the distilled water for now. And I'll just very gently clean the lenses in a circular motion. And then a dry piece and do exactly the same. Look at that, so much better. And then I'm going to take a piece and just put the distilled water on and clean the other lenses as well, just to make sure there's nothing collected on them. And then a dry piece as well to dry those off. I'm just going to dust the rest of the platform before I work any lower. Then I'm just going to dust off the rest of this. It is always good to have the microscope professionally serviced every 200 hours, just to make sure that anything that might be trapped inside the lenses is properly cleansed. Make sure that the platform is balanced and maintained, and then just make sure everything else is in tune. It's not always a good idea to take apart a microscope by yourself unless you know exactly what you're doing, because there's a lot of pieces that may be hard to get back together. Alright, so everything is dusted and clean. To change the light bulbs in this particular machine, we have a note on here that says call for repair or bulb changes. So this guy particularly needs somebody else to change it. It's not easy to get into the bulb area, but if that needs to be done, or any other serious maintenance needs to be done, we have a number to call. And then if you ever have to carry or move it, it's always good to grab from the back and the base, never from the platform, because that can unbalance it. So then when I'm done, I'll just recover it and leave it for the next person. Oh, it's also important that when you're turning it off, before covering it, you let it cool before you move it around. It just helps keep everything in check. Next, I'm going to show how to do an ELISA test, E-L-I-S-A. I chose the canine heartworm. So first you grab the actual heartworm test and open it. And this requires 1 drop of blood to 2 drops of the solution. So there's the little solution that comes with. Next, you want to take the needle and heparin. This one needs a heparinized needle. So you just pull the heparin all the way in the syringe just to coat it. Leave a teeny bit in the hub. So there's the heparinized needle. Next, you draw the blood. Okay, now that I've got the blood in the heparinized needle, take the needle off. And then in that well, place 1 drop of the blood and 2 drops of the buffer. And then You'll wait for the first line to appear, and you'll see the fluid go all the way across the screen. And then if there's 2 lines, it's positive, 1 is negative. And that takes about 15 minutes. We'll come back. Okay, Pixie's heartworm test is done. Originally I said it takes 15 minutes. It's actually 10 for this particular test. And as you can see, the fluid went all the way across. There's only 1 line. There's not 2 lines. So this is the control. This line should always come up. That's how you know this is working. If there's a second line there by the T, that means that she would be heartworm positive, and she is not. She is heartworm negative. So that is how you use a heartworm ELISA test. Next, I'm going to perform an ear swab on Ocean here. And I've got to find, whoops, other ear. Her bad ear. Take the swab. Whoop, I no see. I no see. And try to get some of the wax or yeast onto the Q-tip. And then take your slide and just gently smear it on to your slide, and then go view it under the microscope. Okay, after we're done doing the ear swab, you take the slide and gently and lightly heat fix the slide, and what that does is dissolve any of the excess wax, if there is any. You don't want to get the slide too hot because that might disrupt the rest of the cells. So just a quick couple swipes. Now that that's done, put the slide into the ear cytology diff quick, and that'll be about 10 seconds or 10 dips. Make sure the slide is all the way immersed. And then tap off, and any excess stain, you rinse the side that does not have the Now that that's wet, we'll let that sit for a few minutes and air dry, and then we'll look under the microscope. Okay, now that my slide has been dried, take it over to the microscope. Get that turned on and adjusted. First, you're going to just do a scope, quick view over the slide to see if there's anything that stands out that needs to be looked at a little bit closer. So we'll just quickly scan through. And I like to start left to right, and then I know which direction I'm going in. And after done looking at the low power, you next do the high dry. And then the things that we're looking for with the high dry are squamous epithelial cells, yeast, which is the Mollistesia, I think I'm saying that right, yeast, which is the most common with an ear infection, and that will be kind of a peanut shape, small. And then you'll also be looking for different types of bacteria. So cocci is round, or the bacilli, hopefully I'm saying that right, is rod shaped. And I'm not seeing a whole lot of that in Ocean's ears, which means that her infection has cleared up quite a bit and she's doing good. You'll also want to look for any inflammation cells, red blood cells, so that could be treated accordingly. And she has been on Rimadyl for her inflammation, and she seems to be doing good. And that's looking at an... Alright, we are going to perform a necropsy on this little rat here. And the first thing I'm going to do is get his weight, and it is already turned on and set. And he is 3.85 ounces. We're going to just tape him down so he's in position for the doctor to make her cuts. And for all of our tools, we have some formalin jars, a couple of blades, a 5 and a 10 blade, blade holder, thumb forceps, Metzenbaum scissors, needle holders. I'm drawing a blank on this one. Needle driver. Hemostat. Say again.
Said a 10 and a 5 blade.
Oh, 15 blade. 5 blade.
So the purpose of a necropsy would be, ideally, you know, this is a feeder rat that gave his life for science, and for Sarah, but normally what you're doing is you're just trying to find a cause of death or any sort of abnormal pathology, or if it's all normal, you record that as well. You try to do it in a systematic way, making a midline incision, and then examining all the organs. You know, obviously if the pet died of respiratory things, you're going to maybe pay more attention to the lungs or heart. But for now, we're just going to see what's going on with this little guy. So you want to make a midline incision. Trying not to go through everything at once. Very similar to a spay incision. He's very small. I'm going to make that incision a lot bigger. You're trying to see everything. I don't want to go into the rib cage quite yet. So I'm just going to generally go through the internal organs. And he's been frozen, so he's going to look a little, the coloring might be off. You can't see this on the camera, but there's no, you know, there's no cancerous lesions in his mesentery. His kidneys are nice and uniform and the right color. But let's say they weren't. He's small enough we can take the entire kidney. I'm going to give it to Sarah. And try not to touch her instruments to the formalin. And she's going to seal that up nice and tight and then immediately label it.
Label it as a kidney? Right on that?
Yeah. And the animal's name, if this little guy had a name, the date, my name. And even though I know that this is sort of an artifact from the freezing, we're going to take a little piece of this colon. I can get it out of the way. It's sort of unrealistic because usually they bleed a lot more when they haven't been frozen. This is a piece of colon. And Sarah's going to label that again.
So is that the stomach?
Oops. Oops, that's not what you want to hear from your doctor. So this is his little spleen.
Oh,
It's really cute.
it's
It's grossly normal, very even in its texture and color. No lesions on it. That's the stomach. Same with his stomach. So far this guy's a little bit boring, but
I think he was a young rat.
yeah. And certainly if you were worried about a foreign body, you'd run the bowel and anything, you know, that looked like it was ischemic or a different color, or if you needed to get you could get the whole stomach in a guy his size, or a cat or a small dog. I'm trying to get to the liver. I want to look at all the liver. Again, I think this guy was pretty young and otherwise healthy. We're going to get a sample of the left cranial liver lobe. And in a dog or a cat, you're just going to get a section. Ideally, you want to get a section of anything that looks abnormal. Or even grossly normal if there was some indication for it on blood work.
Uh-oh. Is this still recording?
Just
run your finger.
So left cranial liver lobe. Sarah's going to label that for me. I think that's it. I think the biggest thing is just to be systematic. And if you can, get samples of abnormal and normal tissue for each organ that you're concerned about. And just make sure you don't skip anything. Now, if this was a pet, I would actually suture them closed if they were going to go on for communal cremation or definitely for burial. I'd probably try to be a little bit
During a
neater.
necropsy, to protect ourselves, we wear gloves, a gown, mask. For larger animals, cover your hair, and any protective shoes if it was supposed to be messy. And also, eye protection is also a good idea for a larger animal. For samples, you have the formalin jar, and here I've labeled it with the date. Normally a name, date of birth if you have that. Since this was a rat, we do not know how old it was, what it is, and then also the doctor's name. And this here is the colon. And you wear gloves with formalin to protect your hands. And packaging it up, put a seal around the top so in case it were leaking during transport. And then put this in a box with probably some bubble wrap, something to keep it from being jarred around. And absorbent material in case it does leak to protect the person that's going to be opening it. For rabies protection protocol, it is important for every tech and doctor that is involved in taking a sample, which would be the head of a small animal or the brain of a very large animal, 100 plus pounds, is to wear gloves, thick protective gloves for cutting so you don't accidentally get yourself. Eye protection, eyes are considered to be the most susceptible to the disease. Face mask, a gown or coveralls, something of that sort, and shoe protectant or covers for your shoes so nothing gets into your shoe wear. On top of that, for shipping the sample, there should be a sheet that you fill out with the vaccine records, if possible, when the last time the animal received the vaccine, if the rabies is current. If it's not current, you would also mark that. The sample should not be frozen. It should be placed into like maybe one of the styrofoam containers with some cool packs and excuse me, I've been sick for a week and I can't get over it. The cool packs and then some maybe absorptive materials and properly labeled for the lab that it's being sent to, the state lab or the public health laboratory. Also, sorry, I wrote a couple notes for myself because can't think. Let's see. Also, the body can be sent to a landfill or other such thing once the body has been declared that it is rabies free. But the most important is wearing protective wear, especially when you're cutting the head. You don't want any of the spinal fluid or blood or brain.
Yes, I think Shannon should let her.
All right, we are going to do vaginal cytology on Sheba here. So So I have some
Sterile Q-tips.
sterile Q-tips and a couple of slides, oops, which I'm having difficulties picking up. You look nervous.
Rabbit sleeps.
Yeah, maybe. Her tail's stronger than I thought.
Good girl.
I know.
You got
Good
this.
girl.
Good girl. Easy,
I
babe.
know.
I know.
Just slide the Q-tip in.
Easy, babe.
I know I'm sassy.
You're alright.
Do a little spin. Okay, you're good. You're good. You're good. That worst is over. And then roll the Q-tip across the slide. One. We'll do a second one.
Wanted to spaz out there for a second.
All right. And okay, for the vaginal cytology, I'm now going to do the stains. First, I'm going to start with fixative. So it's about 10 seconds or 10 dips. Just tap off the stain in between so you're not contaminating the other jars. Next, I'm using the red. And it's the same thing. Tap that off. And then once that's done, take it over the sink and rinse off the side that is not the tampered glass. Get the excess stain off. I'm just using distilled water rather than tap water. It's not as strong. And then set the slide to dry. And then once the slide is dry, I'll look at the microscope and see what cells are on the slide. So the purpose of the vaginal cytology is to see what stage of estrus the animal might be in. There's anaestrus, proestrus, estrus, and diestrus. And in each stage, there's different cornified cells. So the more round cells are less cornified, the more angular cells are cornified, and depending on how cornified the cells are, they may be more into estrus, such as diestrus, or if they're more rounded, they might be anaestrus. So on Sheba's cytology here that I have stained, I am looking at it, and her cells are rounded and less cornified. And by scanning this, I can tell that she's not in heat, so she's in anaestrus. And then I'm also seeing some just regular epithelial cells and a few bacterial cells, which is normal. That's normal by vaginal cytology. If I saw an exceptional amount of bacteria, I would be a little bit concerned, but that's not what I'm seeing here. So with her cytology, I would say that she's an anestrus, which means for my cross matching, I have my blood from my recipient, oops, that way, and my blood from my donor. And I'm going to spin down these 4 samples. And it's important when you're spinning that you have equal weights on either side so it doesn't throw it off. And I'm going to spin that for a few minutes and then we'll come back to the next step. Alright, there it goes. Okay, step 2, I have decanted the plasma off of my EDTA tubes, and now I'm going to spin these down. They have saline in them. And I'm going to do this twice, and I'm washing the red blood cells until it's a clear appearance. And that's for about 1 minute. Alright. Okay, now that I have thoroughly washed my red blood cells with the EDTA tube and saline, I've ran it 3 times, spun it 3 times, I am going to make my 2% erythrocyte suspension. So I've got my 2, this way, suspension tubes. And what I'm going to do with these is add 0.02 mils excuse me, of the packed washed erythrocytes into the tube. And this one is labeled Shiva, so I need to make sure I grab Shiva. There we go. There's Shiva. And I've got my syringe so I can measure it properly. Holes don't quite work for these, so I have to be careful not to knock them over. And gently pull this off without remixing the suspension. Alright, I got my 0.02 and I'm going to put that into my suspension tube. And I'm going to do the same with Pixies. And then I need 0.98 mils of saline. So I'm just going to measure that in my syringe here. 9, 8, and I'm going to put that in with the suspension for Shiva, and then I'll do the same with Pixie. Next, I'm going to start my controls. I will do with Pixie, I will do 2 drops of her own suspension and 2 drops of her own serum, and then I will do the same with Sheba. So I've got two drops. And then I'll just mix that gently and set it aside. Okay, now I'm going to start my major cross match, which is 2 drops of the recipient's serum and 2 drops of the donor's cell suspension. So I'm going to start with my empty container, and this one is major. I've got it labeled. So I'm going to take the 2 drops of the recipient's serum, dip that in here and sucks them up, and we got there we go. Okay, so we've got 1 and 2 drops. Set that down, and then take 2 drops of the serum. Okay, and then I'm just going to cap that tightly and gently mix it. So I'm just going to gently mix that just by tapping it. And I'm going to set that to the side here. Alright, next I'm going to start the minor cross match, which is excuse me, 2 drops of the donor's serum and 2 drops of the recipient's suspension. So I've got my recipient's suspension. Just take 2 drops of that and drop it into my labeled container. And then 2 drops of my serum. And I'll gently mix that and set it aside. I'll just gently mix it by tapping it very lightly. Alright. Okay, now that I have my major, my minor, and my 2 controls for cross matching, I've got them in their little holder, and I'm just going to gently mix them by very gently shaking them and or tapping them. And then I'm going to let this sit for 30 minutes and come back and check on them and look for any agglutination. Okay, it's been 30 minutes of the incubation time at room temperature for all of my tubes here for the major, minor, and control. So I am going to take them and centrifuge them for 1 minute, and then we'll come back. Okay, my minor, major, and my 2 control tubes are done spinning down. So I am just going to check the major and the minor for any agglutination. And I am looking at them, and from the tube, it does not look like there is. I'm going to gently tap it just to remix it to see. It does not look like on the major. And I do not see any on the minor. So next I'm just going to take a drop of each and put them on slides and look at them under the slide, under the microscope. Okay, first, since I didn't see any agglutination in the actual tubes, I am now looking at the slide. The first slide I'm looking at is the minor. And so far it all looks to be evenly dispersed. All of the erythrocytes seem to be evenly dispersed. I'm pulling over my other slide so I can look at that when I'm ready. So I have the light, the condenser low, and I'm looking under my low power. There's no clumping. I'm just going to scan the entire slide where the drop is. And it's all very evenly dispersed. So I'm going to go ahead and look at the major. Too far. All of the erythrocytes are looking very evenly spaced on this one as well. So it looks like Sheba and Pixie are compatible, which is very good to know. And okay, Ocean here is going to help me with the skin scraping. She's got a little abrasion on her ankle that she's been licking and chewing at that is scabbed. So we're just going to take some mineral oil and put a drop of it on to my slide. So there is my slide and my mineral oil. And I've got my cover slip. And then I'm just going to take a blade I'm going to dip my blade into the mineral oil. And I'm just going to take the blade and gently scrape it along her abrasion. And if I were looking for great. So I've got some skin cells on my scalpel. I'm just going to put it on to the slide. And then I'm going to put my cover slip right over the oil. And then I will go and look under the microscope. Okay, with Ocean skin scraping, I just did the surface cells. I didn't go very deep because I wasn't suspecting mites. If I was suspecting mites, go a little bit deeper into the capillaries until the pet bleeds. Not too deep because you don't want to cut the pet, but deep enough that you get blood within the slide. So now I have my slide set up with the cover slip and the oil. Oops, as I bumped the thing. So now I'm going to look at her slide and I'm just going to see if there's any fungus, bacteria, or mites. So some of the mites that I might be looking for are Demodex. So there's a couple of pictures of Demodex, the egg and the actual mite itself. It's kind of rare to see most mites in this area, so we don't see it too often. If we do, they're from down in the Bay Area. These are Sarcoptes scabies. That's the big guy. And its eggs. Or the Chelatilla. Not sure if I'm saying that right. I'm not very good with that. Which are the bottom two, the eggs, or the mite itself. So those are some of the things that you would be looking for with a skin scraping. For Ocean, I would suspect more of a fungus or a bacteria, just because of the area we're in. And she has not been out of the area, and I'm looking at her cells, and I am not seeing any mites, I'm not seeing any eggs. So she'd be clear from the mites. I'm not really seeing any bacteria. Maybe a little bit of fungus. So we'll give her a cream for that, shave and clip the area and keep it clean.